begin with, I spent 28 years in the Army, 3 tours in Vietnam, so in infantry and special forces units. And I saw firsthand and lived through what so many veterans have to live through in combat situations. So it's my passion to help young men and women who have suffered those things. And even if they haven't suffered in combat, if for some reason they find themselves in a situation where they need help, it's been my passion to do that. So 10 years ago, my daughter and I opened a training farm for them. And my first love there is beekeeping, believe it or not. And over the last 10 years, I've been able to work with them. We've trained actually about 3,000 now. And whenever we have someone that's suicidal, that's where I like to be with them. Like is not the right word. That's where I prefer to be. I'm working with 2 right now that are suicidal. And I think there's been about 200 to 250 somewhere in that vicinity of persons that have been suicidal and even on suicide watch lists when they're working with us. We bring them into our program, and that's the first step. So there's something that we have that begins to build a relationship, and it's our program. And so we go together, and within a day, sometimes even within a couple of hours, we have a relationship that begins because we're both veterans. And not just we, I mean, sometimes it's 3 or 4 people with me. But we kind of understand one another. There's kind of an instant brotherhood there. And after a while of getting to know them, they open up. And in a short time, you can usually tell exactly who's having a problem. I mean, the depression, the anxiety, sometimes they'll attempt to mask it, other times they're just withdrawn, and you can tell right up front. So after a while, and I'm not a clinical psychologist like my daughter is, but to be able to tell that there's a problem there is obvious. And so you begin the dialogue. One of the bridges there is that you've been there. It's too bad that the Army doesn't have all kinds of psychologists and clinical psychologists who have been through this sort of thing, because they seem to understand. Yeah, I mean, it's the things you go through aren't just something of the mind or the body. It's something of the soul, in my opinion. I mean, it's a deep and wide issue with a person. Anytime a person wants to take their own life, there's something pretty deep there, and that's what war is all about. And the military doesn't do a very good job, in my opinion, of preparing them. I mean, so the enemy is always someone who is lesser, almost animal-like. And it's done that way for a purpose, to make it so that it's easier to take their lives. But instead of doing that, it seems to me that we ought to be upfront with our young men and women and let them know that they're going to be up against something that may become a moral problem for them later, or a psychological problem for them later. But to be able to develop this relationship with them and then begin the discussion with them about where they are, and if you discern that they're in a pretty deep, dark place, then you have to ask them, are you thinking about taking your own life? Are you feeling worthless and you just don't want to be here anymore? And if you ask them that right up front, usually they won't tell you. But once you develop a little relationship with them and spend some time and show interest in them, then they'll be right up front. And every one of them that I've worked with have been right there, and they're sort of glad you asked, almost. I didn't think anybody cared. So well, I can help you. We can help you with the right therapy, the right therapist, a psychologist, psychiatrist, VA, or even one locally. And we can help you programmatically by running you through a program with someone who cares that will help you learn something that's kind of counter to what you were in the military, in farming and growing things, thinking about positive outcomes and seeing it firsthand. In our case, the beekeeping seems to be strangely very, very effective therapy. It's been used since the Civil War. It's just amazing to see someone come away from that. I mean, you walk alongside them, and in a couple of weeks you see an improvement, all anecdotal. And then in 3 months you see them off pills, maybe a sleeping pill after they come to us with 15, 16 pills a day. And then after 6 months, see them reintegrate into society to a degree, reestablish a relationship with their family. And it's just a wonderful thing to have them say, I'm back again. You know?